Researchers launching a new groundbreaking study helping them predict and prevent heart disease in humans. Now, the project is called Health eHeart Study, and it would use smartphones, sensors, and other devices to gather blood pressure, physical activity, and sleep habits, all in real time. Now, their goal is to enroll more than 1 million people from all over the world. Joining me now, Gerri Olgin, Chief of Cardiology at the University of California, San Francisco, and he is heading up this study. Dr. Gerri, thanks for coming on tonight. I think this is a fascinating study, and it would essentially be a bigger Framingham. I think a lot of people are familiar with that study, landmark study that looked at the causes of cardiovascular disease. How are you going to use technology to help expand the information you can access?
Well, in a few ways. So the Framingham Heart Study, which has taught us a lot about heart disease risk, started out with just 3,000 or 4,000 people. And it required people to go to a particular clinic in Massachusetts. So you had to live within a certain area to be a part of it. We hope to use technology to expand that to large numbers of people and collect data more than just once a year or once every 2 years, but every day if possible, to really give us large amounts of data in large amounts of diverse types of people.
So you're going to look at all kinds of people with all kinds of data points. You know, we already saw cardiovascular disease in this country go down because of Framingham. It sounds like your results could actually drive those numbers even lower.
Yeah, so even with the results we know from Framingham, it's still the #1 killer, kills more people than all cancers and HIV combined. 1 in 3 people still have heart disease, and there's a person that dies of a heart attack every minute in this country. So despite those major advances, it still remains a big problem in healthcare in the United States.
You know, I think one of the things that's little understood, and I'm wondering if you're going to try to shed light on, is women and heart disease. You know, often women don't even know they have heart disease, and they show it in different ways from men. Will that be a part of your study?
Absolutely. One of the major goals of our study is to take what Framingham and other studies have done from a population standpoint and really try to understand those risks at an individual level, whether that be, you know, women or particular ethnic groups within genders, but really try to get an individual level prediction for heart disease and heart disease progression.
Tell us more about how you're going to use technology to actually develop all this information that you could then use to diagnose.
Well, several ways. So one way is that through using the internet, people won't actually have to come in to a clinic for a particular visit. They'll be able to provide information to us just using the internet.
So would I take my own blood pressure?
Yes, in fact, I have a sample here. So this is just a Bluetooth-enabled blood pressure cuff that's relatively inexpensive, and it just connects with your smartphone to provide blood pressure, and then that gets transmitted to the study instantaneously.
So it's automatic? You don't even have to worry about putting anything in an email to anybody anywhere? It happens right away?
Nope.
What other methods
That's
do you have?
exactly right.
What other methods do you have?
So we also have ways to track activity using things like Fitbit or other devices that measure activity and exercise. We have tools built right into the smartphone that can measure pulse rate just using the camera and your finger.
Cool.
We have tools on the phone that track people's behavior, their activity, potentially their mood and their sleep. We have an app that will track people's diet, so in real time they can take pictures of what they eat, and we can do image analysis to determine what types of food they're eating and how much, as well as machines to track an EKG just using the phone, a case on the phone to provide an EKG.
That's awesome. It sounds to me like you're going to gather all kinds of data. I'm sure this will take quite some time to put together. Doctor, thanks for coming on tonight. Fascinating study. We'll definitely be tracking what you do. Thank you.
My pleasure. Thanks for having me.
Now, if you want more information, you want to be a part of the study, the eHeart Study, log on to health-eheartstudy.org. You can be a part of it. They're going to test 1 million people out there. Next, I'll break down one congressman's attempt to work from home and Speaker Boehner offering his reasons why President Obama has yet to release his budget plan. They make up tonight's top 5.